Now let's talk a little bit about these locked up medical supplies at our ports, which has been there for over 2 years. Now, minorities giving government 24 hours to clear up all Global Fund locked up consignments from the ports or face their wrath as they demand an explanation to how an 80 million cedis allocation for counterpart funding was used. Let's delve into the issues. And joining me this morning is the Member of Parliament for Joabuso constituency and ranking member on the Health Committee in Parliament, Kwabena Minta Akando. Honorable, thank you for joining us this morning. Now, you've given the government 24-hour ultimatum, but I want you to situate the issue for me. What are your concerns this morning?
So thank you very much for having me. As we stated in our press engagement yesterday, this issue, apart from the fact that government is deliberately preventing the citizens of this country from having quality health care, it has become an international embarrassment to Ghana. Recently, I was part of the delegation to WHO, the World Health Assembly, and this issue came up in about 3 side meetings. And in all the meetings, it was a huge embarrassment to Ghana. And it's quite unconscionable. Anybody who attempts to justify this particular issue, for me, I would be extremely shocked. So as you rightly stated in your introduction, these supplies came as far back in May last year. And you see, these are grants, these are medications that have been donated by some other jurisdictions, taxpayers' money. And it is given to Ghana free of charge. So why should that leave the country of origin, arrive at your end, and then you say that you cannot clear the containers for the benefit of the people in the country? It doesn't make sense anywhere. And let me tell you, both in the history of Ghana and in the history of Global Fund, this has never happened before. Ghana is not the only country Global Fund is dealing with. It has never happened in the history of Global Fund before. It's a huge embarrassment. Huge embarrassment. Okay? Anytime a consignment takes off from its country of origin, they notify all the agencies involved in the mother ministry, including the Ministry of Health. And so they will send you the invoices, they will send you the bill of lading and anything. My sister, there are 2 approaches to this issue. Whether you decide to waive all taxes and duties, and that kicks in immediately you receive the bill of lading. And so when you start the processes, before the consignment arrives at your end, you just go ahead and clear. And that will not take any time. Or you make a clear law exempting all these medications from duties and taxes. And so that when, in the first instance, what I suggested, the Ministry of Finance can even go ahead and waive the taxes and then bring these documents to Parliament for ratification. Or you can still go ahead and then bring these laws for exemptions so that you don't need to come to Parliament for any waiver. And I don't see why this is so difficult to do, so such that we have to leave this consignment for over a year at the port. Of course, you know that these medications have their lifespan, and so some of them are even expiring. Apart from that, anytime Global Fund is giving us a grant, for example, the 5th cycle ended in December 2023, and that we benefited not less than $233 million from that cycle. Now, another cycle has started, which starts from January 2024 to January 2026. And in that grant, we are going to benefit not less than $248 million and additional $100 million. These are grants. In the grant, Ghana is expected to pay a counterpart funding. And let me throw light on this counterpart funding. In this case, it is not money that Ghana must pay to Global Fund before they give us the grant. But what it is expected of Ghana is that we calculate the 15%, then we buy items, medications worth the 15%. and then we show evidence of the procurement to Global Fund, and that will suffice as our contribution of the 15%. We don't need to give the money to Global Fund. We have to go and buy the medication ourselves for our own use.
And that hasn't happened yet? Is that what you're saying?
Hello?
Are you saying that hasn't happened yet?
That is the bone of contention. And we have faulted for about 33 million, defaulted for about 33 million US dollars. And quite above all the facts I have given you, anytime Global Fund is bringing any consignment, they also add some amount, about 1% of the grant, to the consignment for clearing the goods.
Okay.
That is
now,
what Mr. Gando,
my concern now, when we talk about government, you are also part of government. You are a minority and you are ranking member on the Health Committee. Why do you think it has taken us so long? And you're now issuing a 24-hour ultimatum to the government to do something about it. Why has it taken us so long?
In government, we have 3 arms of government. And everybody, and I know you should know better, everybody and its responsibility.
Yes.
We belong to the legislature. And you know we are not the holders of the public purse. You know the responsibilities of the executive. I don't sit at the Ministry of Health, but the Ministry of Health day to day.
No, I'm not saying that it's your responsibility. You're doing something right. You're escalating. You are giving the government 24-hour ultimatum to do something, which is good. My question to you is why it has taken us this long for you to do this now.
Please. If you have indeed followed this conversation, this is not the first time we are speaking to this matter. And I've told you already that this conversation started last year.
Right.
I personally have issued not less than 3 press conferences. I've issued a statement on the floor of the House. And I have also told you that I was part of the delegation to Geneva WHA. And this is about the 5th or 6th time we are having to talk about the issue. So it's not as though we've gone to sleep. And this is the first time we have woken up to come and speak about the matter. So
okay.
That picture will be a wrong one to paint.
That's all right.
And so we have never slept on this issue, and we will never sleep until all the containers are cleared from the port. And the point I was making before you interrupted was that anytime Global Fund is bringing any consignment, they add additional money for the clearing of those goods from our port in every country. And that is estimated as 1% of our grant. Now, when they added the money, then Ghana got back to them and told them that, look, you know what? We have increased our port charges, so that 1% is not enough. Can you imagine? Who does this? Who does this? So it's unconscionable. Nobody can justify it. The level of the irresponsibility of the executive is unprecedented. And I think that with immediate effect, the executive, the minister responsible, the president, the vice president, this is what is important. This is what is important. And when we fight, and at the end of the day, all the containers are cleared from the port, that is where he will find his voice and also come and speak about it. But we have been speaking about this matter for the past 1 year, and the vice president has not found his voice yet on this matter. But let's all pray that today all the containers are cleared from the port. That is where he will find his voice. Please, it's a serious matter.
Right.
It's about the lives of the people in this country. And I think that the executive, as a matter of emergency with immediate effect, must clear. And you see, you know where we have gotten to?
Right.
As part of the engagement yesterday, what we realized was that now what they are saying is that they have succeeded in whether waiving or paying the duties and taxes, but because these consignments have been at the port for a very long time, demurrages have set in. So now they owe demurrages of about 7 million Ghana cedis, and that is what they are battling with now. It doesn't make sense. It doesn't. Make sense.
You say if after 24 hours they don't do something about it, they're going to face your wrath. What does this look like? What are you going to do about it? It looks
like any other thing that we do until these containers are cleared from the port.
Like
and
what?
Issues of health. When we pick one issue, not until we get results, we don't relax, and we will not relax. We will continue to pursue this matter until these containers are cleared from the port. That's what we mean.
But what I really want to understand what some of these actions will be. I mean, aside giving them an ultimatum.
Available to us, what do you call it? Tools available to us as members of parliament include holding the minister to the floor of the house, making statements, demonstrations, what have you. So after the 24 hours, we are monitoring events. We hope that the government will listen and do the needful and then respond positively to clear all these containers from the port. That is what is important. What is important is that we need these medications. What is important is that we must have value for money. That is what is important. As for our actions, if they clear the goods from the port, there will not be any need for. But our concentration as Ghanaians, as media people, must go to making sure that these containers are cleared, so that, the Ghana Medical Association have come up. They have come out to say that in very short time, we are going to run out of medications for tuberculosis. I hope you have read that. And so these are the main issues. And these are the issues we must all concentrate on and put in pressure. Me, I'm a member of parliament from the opposition. I'm the ranking member on the Health Committee. The best and what is expected of me is, under such circumstances, to bring pressure to bear on government to make sure that the right things are done. That is what is expected of me, because I am not the holder of the public purse. And there are some activities that I am not directly responsible, or we, the members of parliament in the minority or on the Health Committee, are not directly responsible. But what is expected of us is what we are doing. And we believe that if indeed our president is a Democrat, if indeed our president cares about the health of the people in this country, if indeed we live in a democratic era, when stakeholders in democracy, in governance, are speaking, and what they are saying makes a lot of noise, a lot of sense, it means that you must respond positively for the benefit of the citizens in the country.
All right. Now, Mr. Kano, while I still have you here, let's talk about the cost of dialysis treatment. Now, government is saying they will absorb the cost of dialysis treatment for 18 years and below. Is that enough? How does it sit with you?
I think we've had conversation on this matter on several occasions. I've made my point clear, and I still stand by those points. I have stated that number one, they are saying that they're going to absorb the cost of dialysis for people under 18 years and above 16 years. If you look at the population by the Ghana Renal report, you realize that the numbers are not there. Below 18 and above 16, they constitute within 20%. So the challenge is the 80%. How are we going to help the 80%? Number one. Number two, I have also stated that this is an ad hoc measure. Ad hoc measure in the sense that with all what they are saying, it will last for only 6 months because we're in an election year. So after the 6 months, what next? We need a sustainable manner or way of financing the dialysis in this country. Now, the third point is that we cannot overburden the National Health Insurance Scheme. We cannot overburden it because even malaria, the National Health Insurance is finding it difficult to pay claims for malaria. So you cannot continue to overburden the National Health Insurance Scheme on other illness, else we will collapse the scheme. So government must think outside the box and roll out a sustainable financial mechanism for the dialysis. Now, the next point is that we must also be talking about access to even dialysis machines. Access to dialysis machines. About 1 month ago, out of the 8 dialysis machines we had in Confanoche about 8 years ago, they were left with only about 2. So access to dialysis machines, you even go to some countries nationwide, some regions in the nation, some regions in the country, especially Western North. You go and you cannot find a single dialysis machine in the whole region. How are we going to have dialysis machines in our district hospitals, in our regional hospitals? It was another conversation. Because even if government decides to absorb the whole cost and you cannot have access to the machine, it's also matter ado about nothing. And so as for the issue of dialysis, I don't think, and you see quite recently, government proposed an increment in the cost of dialysis. That one too, we have stated on the floor of the House that was done in error, and that the minister responsible for health must come back and amend that act so that we will reduce the cost of dialysis for the citizens in this country, and even go ahead and absorb the rest so that at least those patients can also have some kind of relief.
Okay, but like you rightly said, we cannot overburden the National Health Insurance Scheme, and this is an issue of finances. So if this absorbing the cost for only 18 years and below is not enough, what should governments have done? You said they should have thought outside the box, or they should think outside the box. What should they have done? There
are a lot of things they are wasting money on. They spent millions of Ghana cedis on the cathedral. Waste of money. Waste. It doesn't make sense. This money could have been pumped into the cost of dialysis. Number two, since this government took office, they have capped the National Health Insurance Scheme or National Health Insurance Fund. If I say capping, what they have done is that after the collection of the money that you and I pay, and you know how we pay the National Health Insurance levy, after your show, if you decide to go and have breakfast, if you decide to go and have lunch, you pay National Health Insurance levy 2.5. And so these monies are collected in advance payment, forward payment is the most reliable money anybody can get in the system. And so these monies it's a special purpose vehicle. We were supposed to invest the 100% of that money into the National Health Insurance Fund. What this government has done is that after collection, then they will decide to take whatever they want and then give the rest to the fund. And even with that, they are always in arrears. So from 2018 till date, Ghana government, the Nana Danko Akufo-Addo Bawumia government, has capped the National Health Insurance in excess of 6 billion. This 6 billion, you ask yourself, if we have pumped into the cost of dialysis, it would have helped everybody. So there are a lot of wastage in the system that I believe that if indeed we are thinking outside the box, we will find money to do it. We will find money to do it. It's a matter of priority. It's just because it is not a priority of government. Simple. Anything government thinks that is their priority, such as the cathedral, government will find money to do it.
So do you maintain that the NHIA is broke and cannot be sustained? Are they broke?
Oh, we had this conversation last week, and last 2 weeks, press release upon press release, we have had this conversation. The current position is that now, without going back, government is owing the National Health Insurance Authority from July 2003 to date. So the mathematics is that if you take July 2023 to February 2024, the amount government owes the National Health Insurance is about 2.4 billion, excluding March to May. And the whole of 2024, their budget is around 6.8 billion. And so this is how much government is owing the National Health Insurance Authority.
But Dr. Da Costa Waji is saying that they are okay. They are still standing strong. So how do you react to that?
His strong doesn't look strong. So I guess I will have to leave it as one of those issues because, of course, it's a political appointee. You don't expect him to come out and lambast government. But as I speak to you, I'm only giving the figures. We sit on the committee to approve the formula, and we know what exactly is happening in the National Health Insurance. It is quite recently after our press conference that we had to engage the stakeholders to find money for them. And you can ask Da Costa himself. He was part of the meeting to think through how we are going to look for money for them. So we invited the Minister of Finance, we invited the Controller, we invited National Health Insurance, we invited the Ministry, and we had a meeting to get a plan so that we will all follow a roadmap, so that we will all follow, so that the National Health Insurance Authority will continue to have money for the sustenance of the scheme, because it is quite embarrassing and disheartening that holders of the National Health Insurance card will go to health facilities and they will turn them away. And sometimes some of them will have to pay money, what we call the co-payment. So these are the realities happening on the ground. And so the fund has been in arrears for some time now, and it has always been in arrears. And so I think that government needs to set its priorities right, because this is money that should be very reliable. It's not as though, government, we don't have money, so government should go and look for money for the National Health Insurance Scheme. No. It is something that has been created and the people of Ghana are contributing to. So the law says that if you take the National Health Insurance Act, Section 52, Section 52.1 and 52.2, it's clear that when they collect these levies, within 30 days, this money must be lodged directly into the fund for the good use of the authority.
Right.
You understand? So I think that, and see, let's be very careful. Pushing everything onto the fund, the fund will collapse. So we should be able to think outside the box. You know,
right.
And then we have to decap the fund. It's very important. Let's decap the fund. It doesn't speak well of us.
Lastly, before I let you go, Mr. Kando, any updates on Agenda 111 after your checks? Any new information come to light?
To me on
yes, but we
have
you here, so please indulge.
Oh
any updates?
I'm listening.
Based on the checks that you've done, any new information come to light on the Agenda 111 project?
Well, I believe that after this Agenda 111 discussion, you will also.
This is my final question.
To other radio stations and then TV stations, because a lot of them are also trying to reach me for this same conversation of the Global Fund, commodities and medications. Now, on the matter of the National Health Agenda 111,
right?
I have always stated that there was not going to be any 111 hospitals in this country, and that it was too ambitious. And later, the president himself came to vindicate me, because he said he was going to hand over 111 hospitals to the people of this country before he hands over in 2025, January. But the documents available to us as committee members indicate that the financing of this project or program will even go beyond 2027, which of course, Baumia and Ganado will not be the president of this country. So it is not feasible that they are going to build 111 hospitals. What they are going to do and what they were seeking to do was to start something at various sites. And then when it gets to the campaign season, they will say, oh, we are doing this, we are doing that, so vote for us. So when we come to power, we'll come and continue. But as I speak to you now, all the timelines they have given, including the president, they have failed woefully. Not a single one of them have been completed and put to good use. Not a single one of them. In fact, to tell you the truth, this is the first government in the history of Ghana which, for the past 8 years or 7 to 8 years, they have not started, continued, completed, commissioned, and put to good use one single hospital for the entire 7 to 8 years. Not a single one. Not a single one. They are full of deception. You know, so for example, the Lagina Hospital.
Right.
They made all the noise before 2020 election. When the former minister appeared before the President Committee after 2020, that's around 2021, he said the project was near completion, when of course it has even not started. Now, because we are going into another election, they've got to keep another contractor there. The contractor should be on site so that the people will know that they are doing something and they will vote for them. So this government is full of deception. That's what they do best. They deceive the good people of this country, and then they go scot-free. And so, as for the Agenda 111, as far as I'm concerned, the figures available to me and the budget they presented as the last time they appeared before us, they don't have the money to construct 111 hospitals for the good people of this country.
All right.
The stipulated time. Thank you.
Thank you.
Who am I talking to?
Sweetie Abochi, co-host on the AM show. Member of Parliament for Jabusu constituency and ranking member on Health Committee of Parliament, Kwabena Mintah Kando. Thank you for spending part of your morning with us. Right, so that's that for this belt of conversations, but there's still more coming your way. We have AM Exclusive and AM Business coming up next on the AM show. We'll be right back.